Thanks for bearing with us. To our media friends, there is a new format for us. We're trying the Zoom webinar today, so it's just taking us a couple of extra minutes to get everything set. And there will be a few new rules as we move forward. So as soon as we begin, we'll talk a little bit about that as well. Rachel, we're good? Okay. So in this particular platform, we are not able to give you permission to record this, but we will release the entire news briefing as immediately as we can afterward that you will have access to. In addition, you will be able to ask your own questions, but you will have to go into the chat section and raise your hand to let us know that you have a question. We will call on you, unmute your mic, and you will be able to ask your question if you'd like to. If you would like for me to ask your question for you, you're still able to put that into the chat section, and I will ask those as they come up as well. So we're going to begin today on this Thursday with our health commissioner. We want to reach out to Eric Zgodzinski now to talk about a few things. And Eric, as always, we'll ask you to start with the case numbers that you have for today in Lucas County.
Thank you, Chris. Today we have 411 cases, 18 deaths. Again, the unfortunate part about this, again, the last death was a female in her 60s. The breakdown of female versus male: female 219 to males to 198, and the age ranges go from 3 to 98.
Okay, I want to talk a little bit about masks because
Sure.
since we have last been here together to do a news briefing, there has been some new guidance from the CDC and the Ohio Department of Health, which you are also recommending and following. So can you tell us what those recommendations of masks are and what we should be doing?
Sure. Mask or face coverings. I think that's a great way to term this. The face coverings are, those cloths that we talked about last week about a sweater, excuse me, not sweater, but a scarf or a homemade mask, something on those lines that would cover your face. Just some things. If you can go to our website, this checklist is actually there. But let me kind of run through the checklist itself. Again, we should be using coverings in public settings where other social distancing measures are difficult to maintain. Such as grocery stores, pharmacies, public parks, things of that nature. Again, it's a good idea. If you can put one of these on when you're going outside, the better off we all will be. Again, we always want to make sure you maintain that 6-foot separation. It does not matter if you have that mask on or not. Again, it is really important to continue that social distancing. Do not put one of these cloth masks on somebody who's under 2, a child, or anyone who has trouble breathing, or again, incapable of otherwise actually breathing through something along those lines, that covering itself. We really, again, don't want you to use those medical supply masks. Again, maybe these are face coverings, because again, we want to save those masks for those first responders. But again, if you have them and you're going to use them, make sure you're doing the proper thing with the mask as you would with the face covering about how to take it off, put it on. There's some interesting, neat little videos that we've had posted here about masks, but also then if you don't take a mask or put a mask on properly, what could happen? So there's a real good visual that I would direct you back to our website on. Make cloth face mask coverings from household items, such as materials that wood could layer. So a cotton T-shirt, something along those lines. Again, you want to watch out if you're going to buy one of these online, again, to watch for scammers, things of those nature. I know that we have a number of organizations inside the county that are attempting to make these. So again, I would urge you to, if you don't want to make your own, that you could actually seek some of these individuals out. Use the coverings that fit comfortably, but snugly. Again, you want to be able to cover your nose and your mouth. That's important. Again, don't touch your eyes, your mouth. Removing these masks, whether it's a commercial mask or one of these face coverings you have. And always, always, always make sure after you get done touching it, you wash your hands. That's extremely important. Again, want to keep these clean because, again, we will touch our face. We don't want to do that if we have COVID-19 on our fingers. Again, much like I do when I get home, if I'm wearing one of my cloth masks or even my shirts and things of that nature, I immediately take them off, much like a mask. go launder it. Okay? You don't want to use a mask over and over again. You use it once, go ahead and launder it. You can put that back on. That's why it's probably good to have a couple of these laying around the house. Again, we are encouraging to use face coverings and or face masks, but these face coverings are important. Again, it's going to protect other people around you from actually, hopefully, coming down with COVID-19. It's going to limit the risk of you, again, that droplet spread to somebody else. So that's why we're asking for those coverings on your face when you're in those areas, such as grocery stores, pharmacies, other areas that are in the general public where you might come in contact. So, Chris, I think that sums it up pretty well. Anything else on the face mask you think I might need to talk about?
Nope, and we will definitely put the links to all of those resources that we talked about. One other thing is that if you're finding it hard to get your hands on one, though, there is a really great video at the CDC, and you can connect to that. We will put the link to that in the Facebook post when we release this video right after the news briefing today. So you'll be able to just click on that and see how to easily make yourself a face mask if you want to, out of an old t-shirt or some other cloth, and a couple of rubber bands. So that will be very helpful. I know that we had talked about the survey, and the
Yes.
University of Toledo, Dr. Joe Dake has been working with you to gather information on people who aren't sick enough to go to the hospital, but feel like they are experiencing some COVID-19 related symptoms. And you've been getting good response to that, and you have even been able to expand that.
Yeah, I'm excited looking at some preliminary data with Dr. Dake on what's happening with inside Lucas County. But I'm more excited to talk about this. Is that we mentioned this last week that Wood County and Fulton County were going to come online with that survey and allow their residents to partake in that. Again, every time that we can add another county within inside our region to something like this, the better off we are relative to understanding what's happening in each one of our counties, but then as a region. So again, it's important to, again, try to get onto our website, take that survey, walk through it. Again, it's simplistic. It's a checkbox, really, as you move through it. And again, it will give us a good operational picture of what's happening in each one of our counties. But again, more importantly, combined what's happening in general. So we can make a better impact in utilizing resources and information. I'm also kind of excited to say, again, we're in the infancy stage here, but additional public health departments in Northwest Ohio are also possibly going to come online. Again, much like we hear at the hospitals, we also are looking at making sure that we're regionalized with our health departments, and we have been for a long time. Wood County has been our regional coordinator for the last couple of years, and they're doing a great job down there. But again, it's taking us to that next level of making sure that all of Northwest Ohio and Lucas County is being protected as much as possible with this.
Okay, Eric, also want to hit upon, it's a big weekend for a
Yes,
lot of
yes.
folks of faith. So there are, it's a weekend a lot of folks look forward to, the kids look forward to, with family dinners and church services and egg hunts and things like that. So there are some guidelines that the state has put out and that we're trying to get people to follow this weekend as far as that goes.
Again, let's talk about Easter Sunday here. Again, it's a big day for my family. It always has been, and it's hard. Let me tell you, it really is hard to not get together in that, if you would, that party atmosphere where we all can be together. But we're going to try to do some things virtually, so that we still have that connection, but in our own separate families. Which again is sad, but we're going to work that out. Now, church, huge thing I know for my immediate family is church, and we're not going. It's not even open for us to be able to go. But again, having the ability to worship from home is a great thing. There's that virtual masses, and I know that other churches have put their services on the web. So again, I think that's a great thing to do. What we don't want to do, again, I urge churches to rethink this. If they are looking to actually have the congregation come together, please don't. We've worked so hard to, again, flatten the curve to make sure that we limit the amount of disease and mortality in our community. That I really want to stress that And if we start getting together, we're starting to add to the problem that we're trying to address. So I know it's hard. It's hard for me. I'm sure it's hard for a lot of people who want to go to church and be with other people to celebrate this weekend. But please, I urge you, don't. I know we're talking about different ways to get together, but getting together as a group is not the best thing to do, because again, let's look at the disease itself. Uh, you have to really consider that anybody around you and everybody around you has COVID, because we know that people are asymptomatic, that they could be shedding this virus and they would never know it right to you. Again, if you're thinking about coming together as a group, I would really caution you against it and recommend that you don't. So, Chris?
Okay, thank you so much, Commissioner, and we will check back with you on some questions in just a few moments. But we want to we're going to ask you to turn your video off, and we're going to have Chief Brian Byrd join us from the Toledo Fire Department now to talk a little bit with us. And
Good
we're
afternoon.
going to, hi, Chief, we're going to give our interpreter an opportunity. There we go, to get a rest as well. So Desiree, you can turn off your video at this time too. So Chief, you have a big family. What are you doing for Easter?
Well, my sister's disappointed because it was supposed to be at her house this year. But, we're going to be doing it separately as individual families this year. You know, we have to think about what's going on in this virus, and we have to think about it in different ways than we're used to thinking about getting sick. We're worried about other people making us sick. Well, with this, we have to worry about the fact that we may make someone else sick and not even know that we're shedding the virus, as Eric was just saying. So we have to worry about taking care of ourselves and other people by doing the social distancing.
We wanted to talk to you because not only do you have a great bird's eye view of our community, excuse the pun, from your job as Toledo Fire Chief, but you're also involved very heavily in public health and a lot of health coalitions, both nationally and locally. And wanted to talk a little bit about minority population that is often hard hit under circumstances like the COVID-19 pandemic that we're experiencing right now. We know that disproportionately they are affected in getting the disease and in dying from the disease in this country right now. What do our vulnerable populations here in our community need to know in order to protect themselves from COVID-19?
First of all, I mean, health disparities already exist in the African American community. We know that, especially with the men. You know, they have a 10-year or a lifespan on an average of 10 years less than everyone else. We know that. It's things such as diabetes, heart disease, kidney disease, high blood pressure. These are things that are already an epidemic in the Black community. So now when you throw an epidemic on top of an epidemic, it's going to have a negative effect, and those people are going to be more vulnerable to catching this virus and suffering more from it. And that's what's going on. So we have to think about the fact that we need to follow the CDC guidelines, wear a mask, socially distance yourselves. And, you know, we don't want to be away from our families, but we have to consider it. And here's something that I personally witnessed. This was after the stay-at-home order was given. And within 2 days, I drove past 2 funeral homes that had large gatherings and a church that had a large gathering for a funeral. This was after the stay-at-home orders had been given. We have to think about this in different ways. We know everyone needs to grieve. We need to be able to say goodbye to our loved ones. But at the same time, we can't let that grief for one person now cause grief for other people in our family, because now they have come into contact with someone unknowingly who had a virus at this large gathering. And now instead of going to one funeral, we're going to multiple funerals. Those are the sorts of things we need to think about.
It is difficult, I think, for people because a lot of things that we do are habits, right? If you're used to getting your buddies in the car together and going to the park and playing basketball or those types of things, a lot of that is habit, and we just really have to be mindful of those types of things that we do with our friends and family under these circumstances.
Yes.
Yeah.
You know, I've got three sons that they do this parkour stuff. So they love to go out and do all these things in a gym and out with their friends. And And they've actually stopped because they understand. And our youngsters who feel vulnerable, or I'm sorry, they don't feel vulnerable. They feel like they're untouchable. They need to realize that they are vulnerable because this virus doesn't care how old you are. And these young people need to know that.
Let's talk about young people in a different way for just a moment, because there have been some stories in the media about African American boys and men especially who are frankly afraid to wear masks or face coverings, even under the current circumstances. So what would you say to those young men or men who might be thinking, I know I need to wear a mask to protect myself, but I'm kind of afraid to wear a mask out in public?
Well, again, we have some issues in society. We know that. We want our young folks to realize that they should have the right to protect themselves just like everybody else does. And they should do that. They have to worry about, again, not just getting sick from someone else, but them making somebody else sick. And we just ask, everyone in general to be conscious of that. Don't let biases get in the way and have you prejudging someone because they're wearing a mask. When if you think about it, your kids are wearing the mask. Your family members are wearing masks. They're wearing it for the same reasons. Our people shouldn't have to be afraid to wear a mask to keep themselves healthy.
Chief, thanks. And I know a lot of people, respect you, look up to you in all communities, our entire community. So you've been out there, you've been seeing how people have been behaving, kind of following this, how people have been pulling together as a community. What is your message to our community right now in Toledo and Lucas County?
As the fire chief, first of all, I have to say thank you. The community has stepped up to help take care of our people, in amazing ways. They're bringing them food. They're leaving signs in the yards of our fire stations. So thank you to the community for looking out for us, because I think they really are out there looking out for them. And we're trying to do what we can to protect our folks so that they can properly protect the citizens.
Okay, we want to open the line now to questions from anybody that might want to ask a question. Again, you can raise your hand. If you have a question, I'm going to take myself out of the video mix. We're going to ask Eric to put himself back up when people ask questions of him. So Eric, when the question is directed to you, you can put yourself up, and same thing with Chief Byrd. And Rachel is going to have to unmute your microphone. Our first question will come from Diane Larson at 13 ABC.
Hello, can you hear me?
Yes.
Awesome. This, I guess, would go to both Eric and Chief Byrd. We have been receiving calls from firefighters who say that they are frustrated that not all of them are being told if a patient they drop off has been diagnosed with COVID. What is the process for letting our first responders know that they may have had exposure to a patient who may have had COVID-19?
Chief, you go ahead and take that, or you want me to?
You can start out and then I'll tag in with you.
Again, the process that we use is the one that was set up here a couple weeks ago for letting individuals know if they're COVID positive or not. We rely on the hospitals to report that to us, and then we go ahead and report back out who they might have come in contact with. So, Chief, relative to the fire department specifically?
Yeah, we have what's called a health and wellness officer that is over at the Emergency Operations Center. If we have any of our people who are exposed or possibly exposed because they weren't wearing their proper PPE or something happened, they responded to a patient who turned out to be sick and are positive, and they just didn't know for whatever reasons. We have a process through that health and wellness officer to get information from our people who were exposed, as well as to get information back to our people who were exposed. They may be quarantined, they may be isolated, and it can lead to testing based on the information that we get from the patients.
Am I still Mike, or can you still hear me?
Yep, you can continue to go.
Oh, awesome, thanks so much. And this one to Eric, we are just getting a ton of calls from Michigan golfers irritated that the mayor mentioned that there may be some restrictions. My question is, part of the amended stay-at-home order that went into effect at midnight required anyone coming into the state, excluding people who work over the state line, say, for example, live in Toledo, work in Lambertville, vice versa, required people coming into the state to be self-quarantined for 14 days. How in the world do you enforce that?
Well, I know that the golf course issue has it just not has come up, but we've been looking at things such as fishing now for a while. That was a huge issue. The governor then said that out-of-state fishing license would not be sold, so that helps us out immensely. But we still have fishermen who I see it all the time, 400 truck going fishing. They might have 6-foot separation when they get down to the river or out on the lake, but again, that's still a concern. And please, I fish, so just to the fisheries, watch that. That is a concern. Let's take a look now at golf courses or those other issues that might come up, whether they're using the metro parks or another facility that we have in Lucas County. We've been looking at that and again trying to figure out the best routes to again make sure that we're adhering to the governor's directive, his order. As well as making sure that we're doing our due diligence to those individuals who work here, but then really focusing on the true fact that, I'm just going to say this: Lucas County in Ohio has taken a very aggressive approach to limiting COVID in all of our communities, and we're seeing that. We're seeing that curve flatten out. So we've taken the brunt of this in the sense that we've worked very hard. I think what the governor is trying to do with that 14-day quarantine order is to say, listen, in Ohio, we're doing the right things, and if you come into our state, you're going to do the right thing too by quarantining. So it goes back to what we're looking at doing and saying, how are we going to enforce this? Yes, you're 100% right. If you're coming to the golf course, you should be quarantined for 14 days, and our golf courses probably should understand that if somebody from another state is coming in, there could be more of a likelihood of them coming in with the disease than individuals here in Ohio golfing on the course, because again, we know what we've done here. We don't really know what Michigan has done per se. It goes the same way with, I think, the fishing concern. That was another option instead of not having being able to sell fishing license to out-of-state residents. So they took another path. So that is good. Again, we need to again continue to be aggressive in looking at those other areas in our community where we have out-of-state residents participating in things and not quarantining. So we're working on that. Matter of fact, working with the prosecutor right now to figure out what we can and cannot do. And we're going to start moving that forward. I don't want to say aggressively, but we need to make sure that out-of-state residents understand that we want that 14-day quarantine order to be implemented, and we're going to make sure that we're doing the right thing for our community.
This is Chief Byrd again. If I can revisit the question to Diane, or from Diane earlier about our firefighters, I need to mention that Emergency Operations Center, that health and wellness officer in that center, is actually working for all of public safety across Lucas County. So our firefighters, our law enforcement across Lucas County, when they get exposures, that information is reported to that health and wellness officer, who then consults with an actual doctor who makes a determination as to what needs to be done with our people when they are exposed.
And in relation to that, Chief, every frontline defender that you are in charge of on the fire department has been able to access a test if they needed it, right? If that was the proper protocol.
Yes, ma'am. Again, that they consult with the doctors, who then determine whether or not those people need to be tested, and that can depend on the patient that they were exposed to and whether or not our people were actually displaying symptoms.
Okay.
Chief, can I just piggyback off of your comment real quick? Again, this process that Chief is talking about is for the entire county. It's a process that is actually very detailed. There are steps to make sure that our first responders are protected as much as possible under the conditions that we're living in right now. There are tests that are being done. They're actually ordered for individuals. There are self-quarantine. I mean, there are many things that go into this process that was really detailed out through talking with multiple first responders, and to make sure that we're covering everything we possibly can. And that again is done through the whole county effort to make sure that, again, our first responders are extremely important every day, but specifically now with this pandemic, we cannot have first responders, be on the front lines and be sick. So we want to make sure that they're taken care of as much as possible.
Okay, thank you both for that answer and that clarification. Brooks Sutherland will be next, and while we're getting him his audio ready to ask the question, just want to let everybody know that Zoom and Facebook are having an issue right now. That's why we were not able to stream this, but we will post this in its entirety on Facebook as soon as we are finished, as we can after we finish the broadcast. Brooks, you have a question.
You guys hear me okay?
Yes, we can hear you.
All right, so this is for Eric. Officials in Wood County made an announcement today that they're going to start reporting probable cases of COVID. And I'm just wondering if this is something that's being done statewide, or if Lucas is going to start reporting probable cases in addition to confirmed cases.
Thanks, Brooks. Yeah, I heard that Wood County was doing that. We already were planning to do that. Staff have already looked at how to again, separate these out and get a better understanding of the case definition. Again, we want to report everything we possibly can, but it needs to be accurate. It needs to be in a process. I think you saw early on with some of the systems that were in place, they were not designed for a pandemic, and so we had to shift those around. But this one, I think, is going to, again, we're in the middle of the pandemic, so we can create that system. So I think it's going to be easier to implement and better and easier to understand as well too. So short answer is yes, we're going to look to separate those out so we report those on a daily basis. I don't know what the state's going to do, but again, I think it's important for the community to kind of understand what's happening. And I just want to warn the community that again, as we report these, you're going to see numbers grow because with the new case definition, if you would, let's just leave it at that for right now. We're going to have to look at many more individuals who we're going to have to follow up with than what we are right now. So you're going to see increase in numbers, and we don't want the community to be scared when they see that. What we want them to understand is that we have more people out here that are, again, ill than what's reported with those positives, because we know asymptomatic cases, we know they infect somebody else who then becomes symptomatic but not enough to go to the hospital. So what this is going to do, this is going to give us a better idea of what's going on in the community, all right? So this is great, so that as we come out of this curve and we come back to, again, let's do quote unquote a normal existence, and as we go through the disease progression into the coming months, we're going to be able to, again, get tools in place, get resources in place, understand what's happening in the community to better respond to, again, you've heard about it, maybe a second wave of this down the road. But again, without the data, without the understanding, without this knowledge, we're going to have a difficult time actually, again, responding to that second wave. So it's good that we're doing this now. We're getting this data. We'll be able then to tease a lot of things out of that as we're sitting to again, plan for any additional events that might come upon us in the next couple of months.
And one more question: just when specifically will that start? Just so the community can maybe be prepared to see those heightened numbers.
Again, I'm hoping early next week. It all depends. Again, Brooks, I don't want to tell you, hey, it's going to happen Monday, but it's going to happen sometime next week. That we can get that up and running. And again, knowing my shop, it's going to be earlier than later. They're pretty dang good out there in what they're doing right now with that epidemiology.
Thank you.
Sure, thank you.
Thanks, Brooks. Next will be Jay Hanna from NBC 24. While his mic is getting released here, I was just going to say, I'm sure the survey that you have already implemented will help you with a head start on that data as well, Eric.
Chris, you make a great point there. It's not just the positives that we have. It's not going to be these probable cases, again, the way the case definition is, but then it's going to be the survey. So, look at this, we just don't have one layer that we're working with for data. We're working with multiple different layers. And as we get these together, we're going to have a better picture of what's happening in our community. Again, it's all about the response for our next issues that might come down in the next couple months, to be able to, again, to say, okay, this is what we need to do for community, and this is where we need resources. So again, I go back to, as health commissioner, I want data. I need data. We in public health need data to make an informed decision, not only about planning, but then about resources and things like that.
Jay, what's your question?
I have a two-part question for Chief Byrd, actually. Now, Chief, with all this data that we've been getting about first responders in quarantine, first responders in isolation, has there been any issues with staffing, or how have you been handling that? And then I guess, have you personally had to deal with like working at home, or staying away from other officers or anything like that?
Right now, we haven't had any real issues with staffing. We have to backfill the people who are either quarantined or isolated to make sure that we can appropriately staff our rigs. And so far, we've been able to do that. But what's ironic about our people and the quarantines and the isolations is so far, none of our people who have tested positive because of a patient contact. So it's been community spread.
Okay, thank you.
Mhm.
Next, Roxana Elias from WTOL has a question. If you can unmute her microphone, Rachel. Roxana?
Hello, can you guys hear me?
Yes.
Okay, so my question is for the health commissioner. I have been getting a lot of messages from mothers about they're worried about their children. And so my question is, of the 411 cases, is there a percentage or a certain amount that you can tell me of how many children are in these confirmed cases?
I don't have the numbers in front of me, so I can't give you a good answer. I know that again, the average age of those that are positive are around 50 years old or so. Again, just doing some crude math there. Again, I got 2 kids at home, and I constantly worry about them as well. I'm out and about now again after self-quarantine, and I'm taking every precaution I can so I don't bring it home. Again, we need as parents to understand that, again, kind of what we talked about, wear that face covering, again, wash your hands. If you're out and about, again, I do the precaution, even if I need to go to the grocery store real quick, I come home and again, I change out of clothes, and I know that's hard, but these are all things to protect our kids. And again, being a parent, it's one thing for me to get it, but it's definitely something totally different for my kids to get it. So we just as parents need to be extremely vigilant in how we do things, and then again, how we protect our kids. Let me see what we can do relative to some data. Again, I can't promise you anything because again, the data it's a pretty big data set right now. But I will promise you that I'll take a look and see what we can come up with.
Thank you.
Sure.
Next is Andrew Asmus from WTOL. Andrew?
All right, now can you hear me?
We can hear you, yes.
Fantastic. I have 2 questions for the chief. One sort of piggybacking off of Jay's question about staffing. I'm wondering if you've had to fall back on any mutual aid sort of setups at all to maintain the minimum staffing levels. And I'm also wondering if any of the firefighters have had any issues with any of the new PPE equipment or gear that they've been working with.
No, we have not had to rely on any mutual aid specifically related to the COVID issue. And our new PPE, we just pushed out the APRs, or the air purifying respirators, to our people who are using those now. And what that does is it extends the life of things like the N95 masks because our people are using the APRs. No, our people love the fact that they have the APRs and the PPE. So we just ask that they continue to, actually we require that they continue to use it correctly, and it's a result of that correct use of the PPE that we haven't had anyone who has tested positive been traced back to an actual patient.
Anything else, Andrew?
One question for the commissioner, if I could. I'm wondering, it's been a few days since the agreement with UT for the well housing has been set up. I'm wondering if that has been utilized at all, if any frontline workers have started staying in the dorms at UT.
I know that contract has been set up, and that we want to go ahead and start using that. I do not know at this point in time the amount of individuals that have partaken in actually utilizing that facility. We can go ahead. I don't know if Chief knows, but again, I don't know if anybody has went in there or not.
We
From-
are efforting. I think we're efforting that answer for you.
Okay.
Chief, you can go ahead.
Oh, I was just going to say, I think we may have a couple people who have utilized some of the housing, but we can get that information because those numbers may change by the day.
All right, thank you.
Okay. Yeah, we're still trying to check on that number for you, Andrew. So hang on, we might still have it. Are there any other questions from our media folks?
Hey, Chris,
Yes.
I can let you know. I believe it's one individual who's partaken in that. So one at this point in time.
Okay.
Thank you.
So far, one. Many other slots available for frontline healthcare workers, firefighters, EMTs, police department, all of those types of people who are working the front lines and don't want to take any potential COVID home with them. Any other questions from our panel right now? From any of our media friends? Okay, we do have one more question from Jay Hanna. Go ahead,
Can you hear
Jay.
me? Okay,
Yeah.
This is back to Eric, and it's kind of in relation to Diane's question. In regards to the Michigan golfers and all of that,
Yeah.
is there any protocol that you guys would do with maybe police or Metro Parks, park rangers, or anything like that to Michigan people eventually have parks as well, or how far is this going to go? You kind of touched on it a little earlier.
Yeah. Again, Jay, what I want to make sure that everybody knows is that we're going to make sure that we protect our community the best that we can. And looking at that 14-day quarantine is a tool that we're going to use. And if we have issues, which again, this community has been so fantastic to respond to many of these concerns, businesses and things of that nature, that I think we'll start making recommendations and asks, and we won't have to go into an order phase. But if we do, we will utilize our law enforcement as we have with, as you heard, individuals who are, not adhering to the social distancing and the group gathering concerns. You've heard of that already, that there has been some law enforcement activity there. So we would do the same thing here, is that we would ask law enforcement to help us out and make sure that we enforce that.
That's good. Thank you.
Thank you.
We also have another question from Brooks Sutherland at the Blade. Brooks? Hold on. There you go.
Can you hear me? You guys had spoke about some of the disparities that minorities face with this. Do we have specific breakdown of race for cases in Lucas County?
Hey, Brooks, it's Eric. We're working on that right now. We're trying to get ahead of that issue. What we're doing is we got whole. Let me take a step back. I'm sorry. So as we're trying to do these master lists of individuals that we're contacting, we're asking a bunch of data. Again, things that are HIPAA that need to be kept into HIPAA confidentiality. But there's some gaps that we're seeing in some of the questions. So what I've asked my staff to do, at least from the health department's perspective as much as we can, is go back and try to fill in some of those gaps. Because what I don't want to do is report data that is skewed one way or another. I want to try to get the best possible data we can. As you know, if you can play games with statistics all you want to, but again, you need to be able to have that data. It has to be truthful. So if we're going to report out, I want to make sure that we fill those gaps. Matter of fact, right before we came on this video chat today, I was talking with my data expert, and to get back with all of our EPIs to again try to get some of that data that we have gaps in, so that again we can report out what actually is going on in our community.
Good.
Any other questions from anyone? All right, could I have Chief Byrd and Eric both turn on their cameras again? Just want to thank you both for being here with us and talking about this. Chief, I especially appreciate you having this conversation with us about some of our vulnerable populations, and it will by no means be the end of that conversation. We will continue to look at those issues and have those conversations as we move forward through this pandemic, but we appreciate you and your candor here with us, and Eric, you as well, and our 2 interpreters, thank you so much. We're going to post this. Sorry for the snafu with Facebook and Zoom today. Apparently they are having some issues technically, and so we will get this posted as quickly as we can with the entire recording on a link that you can access as quickly as possible. Thanks.
Thank you.